This is the Dr. Shoup Show. Talk to the doc and see insider industry info at ddsradio.com.
Well, you can tell everybody. Yeah, you can tell everybody. Go ahead and tell everybody. I'm the man, I'm the man, I'm the man.
All right, class, you junior dentists, here we go. Differential diagnosis time. This is a quiz. If you have a patient that has red blisters on the palms and backs of their hands, they have red blisters on the soles of their feet, and blisters in their mouth or around their mouth, what do they have? Ding, 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 you are correct. They have hand, foot, and mouth disease, which is different than hoof and mouth disease, which is strictly a veterinarian issue, so don't get the two confused. What is hand, foot, and mouth disease? I'll tell you. It's a virus, and this virus exists in a variety of variations and forms, and for some reason or another, and again, we don't understand all the details, but here's the deal. About this time of the year, late summer going into early fall, is when hand, foot, and mouth disease really flourishes. And we think that there may be some connection between the fact that all these kids are shoved back together into schools, but it primarily pops up in school-age children populations. Here's what happens. You develop these blisters on your hands, on your feet, and on your mouth, ergo the name, but they are incredibly painful, and most of the time you develop a really killer fever on top of this. There's been several articles in the newspaper lately about the outbreak. Physicians are yelling that, hey, we got hand, foot, and mouth disease all over the place. Schools are complaining about it. And the problem is these blisters on their hands and mouth are very, very painful, and you run an incredibly high fever associated with it. I mean, you get sick. Adults get this too. If you have a kiddo that has hand, foot, and mouth disease, you as an adult can get this stuff. Adults generally don't get all the blistering for some reason or another. We don't exactly understand why, but man, you feel like you have been hit by a truck, and you have this high fever that you cannot break. You're listening to the Dr. Randy Shoup Show. I am your host, Dr. Randy Shoup, and we're talking about stuff that's currently in the news, and that's hand, foot, and mouth disease. Here's the kicker. Here's what you have to be careful with. This stuff is incredibly contagious. We get parents that'll bring their kids into the office, and we take one look at them, and this is the same way at physicians' office as well. Nobody tests for this. You don't take a blood sample. You don't do any testing for this whatsoever. Dentists, physicians, we look at these kids, we look at the adults and go, oh man, this is what you have. Our first job is to get you the heck out of my office as quickly as possible. I do not want you hanging around my reception room, interacting with other people, because the virus can be spread by virtually any sort of contact. The little blisters, the liquid inside the blisters, filled full of virus. Little kids' runny nose, saliva in their mouth, all filled with the viruses. It spreads by an oral fecal. If little kids go to the bathroom and don't do a very good job cleaning themselves, it spreads that way. I mean, it's just really highly contagious. We tell people, go home, and there is no vaccine for this. There's no way to prevent it. There isn't any particular medication that you can take to make it go away, just like all viruses, and happily they haven't gotten uglier than this. It takes about 7 to 10 days for the virus to run its course. Viruses simply like that 7 to 10 day cycle for some reason or another. Most all of them run that sort of a normal kind of a course where they exacerbate and then they calm back down again. What you have to do is go home, go to bed, fill up yourself with Tylenol, Advil, aspirin, whatever you take. Don't give children aspirin, okay? Do not give children aspirin when they have a fever. There's a thing called Reye's disease, and they get it associated with aspirin. So give kids Tylenol or Advil, okay? and you'll get over it. It'll go away. It is rarely fatal. Now, you feel like you would prefer dying, but you won't, okay? And the kiddos will survive. The biggest problem is their mouths hurt so badly you can't get food in them, and so you just fill them full of water, fill them full of yogurt, fill them full of anything that they will be able to eat. This is not a good choice for taco night, all right? Just get that off of your plate, all right? It's not good for spicy hot sauces. No, keep that off of the plate. But anyway, just give them anything that they will consume, ice cream, whatever, and ride out the storm. So there is a plague of this going around, and so if you get it, you'll know what it is. Go home, stay away from people, don't be contagious, and there you have it. You know all about hand, foot, and mouth disease.
You're listening to the Dr. Shoup Show. Exclusive insider info, audio, and video is online now at ddsradio.com.